Hi, I'm Dr. Eli Whitney, a cardiologist at the Heart and Vascular Institute of Texas. I want to talk about an important and relatively new medication called Jardiance. Also known as empagliflozin, this medicine is shown to have numerous positive effects in patients being treated for adult onset diabetes. This is good news because statistics clearly show that nearly 70% of patients who have adult onset diabetes will die of cardiovascular diseases such as stroke and heart attacks. In addition, poor control of diabetes leads to small vessel disease that causes blindness, kidney failure, and leg amputation. It's all about controlling glucose. Jardiance is a medication that works on the kidneys to improve glucose control. Jardiance only works when the glucose levels are high. Jardiance by itself will not lower blood glucose to dangerously low levels. Every day, our kidneys filter about 700 quarts of blood to remove waste products and keep us healthy. Part of the kidney's function is the reuptake of glucose that has been filtered. Jardiance works by blocking this reuptake of glucose, hence the glucose which was taken out of the blood will pass into the urine. When this occurs, some salt and water is also passed out into the urine along with the glucose. The nice thing about the sodium loss is that it occurs without losing potassium and magnesium, which are important electrolytes in the blood. What happens when glucose and sodium are not kept in the body, but rather passed out in the urine? The first thing is weight loss. On average, patients lose about 3 to 4 pounds when they take Jardiance. Second, blood pressure improves. On average, the blood pressure will drop about 4/2 millimeters of mercury with Jardiance, 10 milligrams per day. In patients with blood pressures greater than 130/80, the drop in blood pressure will be greater at 7/3.5 millimeters of mercury. That means people who have high blood pressures have greater drops in blood pressure than people with lower blood pressures. This is definitely beneficial to adult onset diabetes patients. When it comes to the effect of Jardiance on serum lipids, it's more complex. When taking Jardiance, there's about a 2 milligram percent increase in LDL cholesterol, one of the two bad cholesterols in the blood. This is not a good change. However, triglycerides are lowered roughly by 2 to 3 milligrams percent, and that is good. In addition, HDL cholesterol, the good cholesterol, is improved 4% on average, and this is a very good change. And there is also a very good change in hemoglobin A1C. On average, the hemoglobin A1C levels fall by 0.7 to 1.5 points. Let's take a look at how this clinical data was found. In 2015, 7,020 people took part in the EMPA-REG outcome trial. All of these were patients with adult onset diabetes, and they also had established cardiovascular disease. Established means people with blocked arteries to the neck, heart, and legs. People with previous heart attacks, bypass surgery, angioplasty, and stents. The study also included people with strokes or evidence for blocked arteries to their brain by ultrasound. All patients were treated with standard diabetic diet and standard medications, including insulin. They split these 7,020 patients into 3 groups. 1/3 received a placebo, a pill that looks like a real medication but is made of cornstarch. 1/3 received Jardiance 10 milligrams per day, and 1/3 received Jardiance 25 milligrams per day. All causes of death were reduced 32%, and cardiovascular deaths were reduced by 38%. Non-fatal heart attacks were reduced 12%. With respect to heart failure, basically there are 2 types of congestive heart failure. One type of heart failure is from having a weak heart muscle. The second type of heart failure is from having a stiff heart, but not weak. Jardiance reduces the risk of hospitalization for congestive heart failure by 38% in both types of heart failure. Surprisingly, worsening kidney function was cut almost in half. These improvements occurred in the patients taking Jardiance 10 milligrams per day and in people taking Jardiance 25 milligrams per day. The most surprising thing to me was that this improvement in kidney function occurred in people who had good kidneys and in people who had weak kidneys. And the improvement in deaths was the same in patients who had mild diabetes as in the patients with more severe diabetes. What really mattered was being on Jardiance or not being on Jardiance. Hence, Jardiance will keep people alive who have mild diabetes or diabetes that is more severe. After an average of only 3.1 years, the study had to be stopped because of efficacy. In other words, during progressive phases of the trial, the medication proved so effective at improving conditions in test subjects that it would have been unethical to withhold treatment from those in the trial who received the placebo. The only side effect that was different than placebo was fungal infections. Fungal infections occurred in roughly 5% of the people who took Jardiance and in 1% of the people who got the placebo. Hence, 1 person in 25 will get a fungal infection. This is understandable since the medication increases the output of sugar in the urine and fungus just love sugars to eat. The best way to avoid this side effect is to clean yourself carefully after urinating to remove excess sugar. Urinary tract infections occurred in roughly 20% of the people in both groups in the 3.1-year period of the trial. Hence, urinary tract infections are common in patients with diabetes, but are not made worse by Jardiance. Urinary tract infections should be treated normally, and the therapy with Jardiance continued. There can be other side effects. When first starting medication, your pharmacist may inform you about Fourier's gangrene, which is a severe infection of the skin around the anus and genitals. Out of every 500,000 people, this occurs in 1 person, and it only seems to occur in diabetics. Scientists are determining if this is due to therapy with Jardiance or not. Even so, if you get pain around your anus and genitals, seek medical attention. What I normally do is to start Jardiance 10 milligrams per day, since improvements was virtually the same in the group that got the 10 milligrams per day as the group that got 25 milligrams per day. In summary, Jardiance is an exciting new medication which is an anti-death drug. It lowers risk of all causes of death by 32%, reduces the risk of cardiovascular deaths by 38%, lowers the risk of hospitalization for congestive heart failure by 38%, and the risk of non-fatal heart attacks by 12% within just 3.1 years. The positive side effects include better weight, better blood pressure, better triglyceride levels, better HDL cholesterol levels, better glucose control, and being less likely to develop kidney failure. I hope this medical education program helps you better understand the reasons I am putting you on Jardiance. I want to prevent death, and I want to improve the length and quality of your life. This is Dr. Eli Whitney with the Heart and Vascular Institute of Texas.